We're going to discuss prepping the skin for the application of tape. This is a necessary step that is very important because oftentimes we will get clients calling and saying, my tape doesn't stick well and my patient isn't having it adhere to the skin for very long. And oftentimes that's a cause of the skin actually not being prepped. So we're going to show you how to prep the skin nicely so that the skin does not get irritated, but also so your tape will stick for a longer period of time. So when we're looking at our patient's skin, it needs to be clean and dry. When we're discussing the skin itself, it needs to be skin. So if we have a body part where they have a little bit of hair, if that's not a short hair where this amount of hair would be fine for my particular patient, but if they had hair that makes the tape stand up off the skin, that skin needs to be clipped in order for it to be adhered to the skin itself. Otherwise, it doesn't relay the appropriate message to the underlying tissues for the result that we would like clinically. So in prepping the skin, first we would take either an isopropyl alcohol or on a little bit of a towel or in a towelette form. We can also use it in a spray bottle. And we would get the isopropyl alcohol on a paper towel or a towel and use that in order to clean the skin where we're going to apply the tape. Now, if alcohol is not your preferred method of cleaning the skin, that's fine. There are several other ways we can do it. Alcohol will tend to dry the skin a little bit. So if you have a patient with dry skin to begin with, alcohol would not be my preferred method. If I have a patient with dry skin, which these are the exceptions, not the rule, usually we would like to use alcohol to prep the skin. If it's someone with dry skin, then I might want to use a towelette that's not alcohol-based, or plain soap and water, which works phenomenally well. And if you're using soap and water and you're in a clinical setting, you don't want to go through a lot of face cloths, you don't want to go through a lot of laundry in order to put that on your patient. So you can pick up either a pillowcase or a small cloth, whatever you might have, either a face cloth in your clinic if you use them in your laundry service, and you can put regular soap like your Hibiclens or whatever you might have on your wall in your dispenser. You can put your soap on one end, get the other end soaking wet with water, and I can wash her skin with one end. I can rinse it with the soaking wet end of the towel on the other, and then in the center it's still dry, and I can dry her skin off. And I've only used one linen product in my clinic so that it doesn't cost a lot of money in order to continue to use my linens. So that would be one way to clean it. We can also use regular paper towels or a towelette and clean the skin. These are a product that you can use as a baby wipe. You can get them in different brands, different products. However, if you're in a hospital, they don't allow you to have an open container. And so if you're in a private practice setting, these work nicely. But our preferred method is still straight alcohol. Whether an isopropyl alcohol, you can put it in a squirt bottle, have your patient turn away if it's by the face or neck, and you can spray it on the skin so that you get a nice even spray of your alcohol, and you can then clean the skin with that. If you do it in that way, that's totally fine. Alcohol evaporates and dries very quickly. So then we let it dry, and then our patient is ready to tape. If you are going to use a clipper or a shaving type instrument in order to prep the skin, we don't use a blade that is a straight blade of any kind. So a razor product, a Bic razor, or a razor product that has a straight blade in it rather than a serrated blade, we would not use on any patient. And that's because if it has a blade, it can nick the skin. Where the skin has been broken, we don't want to put a light elastic tape over that, or it will continue to irritate that area. So we want to use a blade that has a serrated edge, much like men's sideburn trimmer, or they have products that you can buy in the pharmacy section of most stores that are a clipper. And you can they're a self-grooming clipper, the type that you can buy to trim hair in the ears, hair in the nose, and they can be used to trim the hair very easily. Even on pediatric patients, it's just a little vibrating noise, and they don't mind that. So we would go ahead, clip any hair that we needed to, not shave, clip, and then we would go ahead and clean the area, and we would proceed with our taping. So make sure that your skin is very well prepped, clean, dry, in order to apply your tape. Another problem that people see at times is people who are perspiring or sweating. The skin needs to be clean and dry. So if the skin is not dry due to perspiration or sweat, we need to make sure that that also is not apparent or on the skin when you apply the tape. So for athletics, I always apply my tape before the athletic event, give it a nice friction rub, and then they can go participate. They do not need to wait the 20 minutes that some people have stated is needed. That is not appropriate. My athletes don't have 20 minutes to wait after I tape them. I imagine yours don't either. So we're going to apply the tape to clean, dry skin, give it a friction rub, and your athlete can go compete. Now, as part of that, if you're during an event and your athlete sustains an injury, then you have to let that perspiration evaporate, dry it off with a towel, and wait. Let the next perspiration come to the surface and evaporate, then dry them off with a towel. And when that process has stopped, then you can apply your tape, give it a friction rub, and they can go participate in their sport. If you don't allow them to sweat because they're already very active and overheated, then your tape is not going to stick if you apply it during an event. Besides letting the sweat and perspiration come off the patient and evaporate, I'm also going to spray them with a tape adherent at that time so that my tape is sure to stick. I still have to use the same steps: skin safety, skin cleaning. I have to apply the tape with a friction rub. Even with my sticky spray on there, I still have to give it a friction rub, and then they can go participate in their sport. Along with our skin preparation for making sure the skin is clean and dry, other products that we might introduce into our skin preparation and skincare would be products that will make the tape stick better, such as the tape adherence that we talked about with your sports athletes. If you're not in a sports environment and you're in a clinical environment, you can certainly do that with products such as Extra Hold Hairspray. You can order them in your clinic, products that are called QDA or Tough Skin. Those products are the things that make things stick better. That would be a tape adherent that'll make the tape stick better to the skin. You can use products if you have a sensitive skin patient or a very small pediatric patient, patients that have had difficulty with Band-Aids in the past, maybe a little skin irritation underneath. Then we can use products called skin protectants. The skin protectants actually will put a barrier between the tape and the patient's skin so that you can still use your taping techniques, but the skin will not be as affected because there is a barrier between them. You can order several of these products through your medical catalogs. One is called Skin Prep, and the other is Cavalon. These products come in both a packet that looks like an alcohol wipe, a small square packet, 1 inch by 1 inch, and you tear that open and it has a little pad with the skin preparation barrier on it that you rub on your patient's skin where you'd like to place the tape. The other product is a product that most all of us have around our house, either milk of magnesia or Maalox or any antacid. Pepto-Bismol will work. And our wound care specialists taught us this. When they would change bandages often on their patients, they would coat the area around the wound. So for us, we would coat the entire area we were going to tape. And then we would let the antacid dry. So the milk of magnesia or the Maalox, we would let it dry. And then you rub off the dried flaky portions, and then you place your tape on the product. And that will also give your patient a skin barrier if they have had some types of sensitivity to tapes in the past. Now again, I would recommend going ahead and signing up for a course after this, because we discussed the differences between a skin irritation versus a T-cell mediated response, which is an absolute allergic reaction. A skin barrier is not going to help you if your patient has had an absolute allergic reaction, not just a skin irritation.